Good evening, everyone. I'm Lissy Bastien. It's Thursday, October 8th. Thanks for staying with us. With public schools only just beginning the 2020-2021 academic year on Monday, with schools in New Providence, Abaco, and Eleuthera operating virtually, and private institutions operating a hybrid of online and face-to-face, all schools on New Providence and Abaco will now only facilitate online learning following the Prime Minister's announcement in the House of Assembly yesterday that all schools in New Providence and Abaco will be closed for face-to-face learning. Education Minister Jeffrey Lloyd says, considering the circumstances and recognizing the urgency of eliminating the transmission of COVID-19, teachers are well equipped for virtual learning.
So this protection that is seeking to be garnished is not only babies, but certainly for those who care for them and provide instructions to them. We would want to, and we expect that shortly after these restrictive periods, and it seems as if it will be sometime around the end of this month, that we will get back to the provision of face-to-face instructions, not only for our preschoolers, but for all of our students.
The Education Minister was speaking during a virtual press conference this morning with Rotary Clubs of the Bahamas and Cable Bahamas group of companies, where digital inclusion, a transition to e-learning, was the topic of discussion. The Ministry of Education has partnered with the organizations, and 10,000 tablets were donated to the ministry. Minister Lloyd adds that the ministry has provided parents and caregivers on its virtual school platform with the necessary materials, enabling them to access information and provide instruction and activities to children. Democratic National Alliance leader Arinthia Kumalafe is the latest to voice concerns following Prime Minister Dr. Hubert Minnis' newly implemented 24-hour weekend lockdowns. Mrs. Kumalafe says yesterday's address was sobering, highlighting the obvious, and drew attention to a leader that has fumbled through the worst national crisis in our generation.
It was sad to watch the competent authority face the nation without a comprehensive plan that enables us to coexist with COVID-19. Instead, a continuous cycle of opening, closing, relaxing, and restricting has become the government's preferred approach. The Democratic National Alliance acknowledges the magnitude of the challenges we face as a nation. However, it is clear that poor decisions and a lack of enforcement are at the root of the current spike in COVID-19 cases since the ill-advised July 1 reopening of our borders. Simply put, a governance crisis and poor planning have put us in a precarious position.
The DNE leader further labels the Prime Minister's handling of the pandemic as disastrous, adding that it has put the country's economic and social recovery in peril.
The botched reopening and failure to strengthen our public health care system makes our jurisdiction unattractive to visitors. Our people are weary, tired, and discouraged due to the lack of preparation, coordination, and direction by the competent authority. This trial and error approach is hurting our people, businesses, and our country. There is no way around an effective testing, tracing, and tracking system supported by proper enforcement of the emergency order.
Mrs. Kumalafe implores the government to review the extensive recommendations of her party, which she says could have prevented the missteps made to date. With the upcoming 24-hour weekend lockdown just hours away, Commissioner of Police Paul Rowe encouraging residents to abide by the emergency powers orders. The nation's chief announced in the House of Assembly on Wednesday 24-hour weekend lockdowns starting at 7 p.m. tomorrow and ending at 5 a.m. on Monday. This weekend, the lockdown will end at 5 a.m. Tuesday for both the capital and Abaco. The lockdowns are to help mitigate against the spread of COVID-19 that has infected more than 4,000 Bahamians and claimed the life of 102 individuals.
The police will be out and ensuring compliance with it, and so we are asking people to just abide. In recent weeks we've been having a lot of challenges with young people in particular having social gatherings and parties, and I want to say to them not to do that, If we find that happening, we'll be taking a more stiffer approach with those persons who seek to defy those orders.
Commissioner Roll assures that the force has more than enough human capital on both New Providence and Abaco during the 24-hour lockdowns. Nearly 90,000 beneficiaries have enrolled in the National Health Insurance Program since its establishment in April 2017. This coming from the chairman of the National Health Insurance Authority, Dr. Robin Roberts, during a virtual press conference yesterday. The NHIA was established to oversee the implementation of NHI in the Bahamas. Dr. Roberts said that they have been receiving positive feedback so far.
While we have been hearing positive feedback about NHI so far, the government of the Bahamas seeks to continue its efforts to deliver on the triple goal of healthcare. That is, to better the patient experience, to improve the health conditions of our people, and to get the best quality services and value for the money we spend on healthcare. This next phase of NHI will bring together the public and private healthcare delivery networks under a common and comprehensive model of care that improves quality, consistency of experience, and access to primary healthcare services without any costs at the point of service.
According to Dr. Roberts, a revised standard health care benefit will be available to those who enroll with their primary care transformation initiative for no additional copays or deductibles to ensure that high-quality primary care health is delivered to all islands of the Bahamas.
The revised standard health care benefit is a package of services that encompasses primary health care coverage and includes all primary health care physician visits, as well as specific laboratory tests, diagnostic imaging, and cancer screening. Integrated into this care will be specific pediatric and maternity coverage, which covers all evidence-based practices for antenatal and newborn care, including all laboratory tests, imaging, and immunizations associated with best outcomes.
The NHI Managing Director Graham Whitmarsh spoke of the cost of supporting their beneficiaries.
The average cost of us delivering care to a beneficiary is $217 per person per year. That includes the visits to the primary healthcare physician and the laboratory tests that we deliver today. So the average cost is $217. The model of care that NHI delivers through the physicians is a little different from what has historically happened and what happens with private providers, in that we pay providers a fixed amount of money for each beneficiary each month. We adjust that depending on the individual's age, their gender, and where they live, because obviously people at different stages in their life have different demands on the health system. And then we pay that fixed amount to the physician, and he takes on a set of responsibilities, or they take on a set of responsibilities for that fee. But $217 per person per year is the current average cost.
Those who want more information on the NHIA can visit their website at www.nhibahamas.gov.bs. You're watching JCN News. When we return, 81 new cases of COVID-19. A man is in custody following a stabbing incident. And hear what the National Security Minister has to say about capital punishment. Stay with us.
This segment of the news was brought to you by Alive.